So we'll study the cancer evasion mechanism. Why it's not easy to overcome the cancer. We think the chemotherapy and immunotherapy can be good answers, but definitely not easy because of the evasion function of the cancer cells. There are two kinds of the cancer evasion mechanism. One is immunity, one is chemotherapy. So what is the evasion of the immunity? First, we think about the PD-L1. PD-L1 is some kind of long arm to block the T cell break function. So the cancer will block the T cell, then the T cell cannot work. Okay, this is another some kind of the immunity. And another one is TF antigen. TF antigen is the special antigen for the cancer cells. But the problem is T cell cannot properly recognize the antigen of the cancer cells. The HLA-G is expressed on the surface of cancer cells. Once HLA-G is expressed, the immunity of the patient cannot properly functioning. NK will be decreased, T cell can be prohibited. Another one is M2. There are two kinds of macrophage. One is M2, one is M1. M1 is good macrophage for our immunity, but M2 is good for cancers. So cancer cells develop the M2. That's why it is called immunity evasion. So another one is chemotherapy evasion. If we give the chemotherapy, the cancer cell will increase the concentration of glutathione. That's why it will evade chemotherapy. So we developed already the cancer, the escaping immune checkpoint. It's called immune checkpoint inhibitor, like Keytruda and Treatable and Evasion. But it's good, but lots of side effects. So you have to overcome this one also. How we will overcome? The checkpoint inhibitor is giving the antibody to the normal cells, immunity. But if you can give the antibody, not the T cells, but the cancer cells, you can get answers. What will be the answers? We have the special the drug, it's called Immunocyte. Immunocyte developed antibody attached to the cancer cells. Another one, we already said T antigen cannot be recognized properly by the T cells, right? So if T cell cannot properly work, then the B cell can work to produce antibody. The two can be done by immunocyanin. The brand name is Immunocyte. And another one, HLA-G. HLA-G is some kind of the protection mechanism of the mother. Okay, once the fetus was implanted to the mother's womb, then the mother will maybe attack fetus. It should not take place. That's why our placenta will secrete HLA-G to prevent the mother's immunity. The cancer also mimics that mechanism. So the cancer cell secrete HLA-G to evade the immunity of the patient. What should be done? HLA-G can be secreted well when our body is inflamed. Inflammation means HLA-G secretion. So what should be done? Inflammation should be decreased by how? Selenium has the power to decrease the inflammation. That's why HLA-G can be reduced. As I mentioned, M2 is good for cancer cells. The role is tumor promotion. It should be shifted to M1, tumor resistance. How? Selenium has the power to shift the M2 to M1. PD-L1 can be decreased. Also, the glutathione can be reduced by the selenium. That's why it can prevent the evasion mechanism of chemotherapy. Also, ROS will attack the normal cells. It has lots of side effects, but ROS can be only tumor cells. This is good answers for our cancer treatment.